Hello students, I hope you all are fine and making a good use of your time. So students, in the previous video, we studied about the criteria for regarding a person as healthy and also improvement in medical facilities of India. Students, did you understand the topics covered in the previous video? Okay, so now we shall move further to discover more about health services criteria in India. Today's segment would be very interesting as we would study about two different stories. First story is of Hakim Sheikh. Students, you might be thinking, what happened with him? So let me satisfy your curiosity. Hakim Sheikh was a member of the PBKMS. Now, what is PBKMS? Students, it is Paschim Bengal Khet Mazdoor Samiti. It is an organization of agriculture laborers in West Bengal. Surely, many of you must be keen to know what is the role of this organization. Let me answer your question. PBKMS promotes the rights of agricultural workers and help them get decent wages and that of guaranteed work under Indian law. So, how about switching back to our story of Hakim Sheikh? One evening in the year 1992, he accidentally fell off a running train and got serious head injuries and required immediate treatment. He was taken to government hospitals, but they refused to admit him because they lacked a spare bed, and in another hospital there was lack of specialized doctors. In this way, he spent 14 hours in a critical condition. So students, according to you, what else he could do? Yes, you are thinking it right. He could go to a private hospital. He did the same, but his lot of money was spent on his treatment. Angry over the attitude of hospitals who refused to admit him, Hakim Sheikh and PBKMS filed a case in the court. Okay, so let us move to the second story, which is of Aman and Ranjan. Aman and Ranjan are good friends, while Ranjan comes from a well-to-do and rich family. Aman comes from a poor family. Coincidentally, both of them suffered from viral fever and had to go to hospital. Both the friends shared their experience with each other. Ranjan went to a private hospital which had a luxurious building and friendly staff. He also told that his father had to pay 500 rupees at the reception counter itself before they even met the doctor. Also, the hospital was very clean and shiny. Whereas Aman visited a public hospital where he had to wait in a long queue at OPD counter, which is outpatient department. This is a place where people are first brought in and treated in a hospital without being admitted to any special ward. After doctor examined him, he sent him for a blood test, for which again he had to stand in a long queue. But the hospital was comparatively very cheap. Okay, so students, what did we understand from both the stories? We came to know about the fact that there is a huge difference between both the hospitals, and we can roughly divide up various healthcare facilities in two categories, which are public health services and private health services. The first category which we are taking into consideration is public health services. Before starting off, I have a question for you. Why people from villages go to cities for treatment? You will get to know in this part. The public health service is a chain of health centers and hospitals run by the government. They are linked together in such a way that they can cover both rural and urban areas, and can also provide treatment to all kinds of problems. From all kinds, I mean common illnesses like fever to major problems like heart disease. Talking about village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctor at the primary health center. Many villages are covered in such a way. I think students, you have got the answer to my question which I asked earlier. Staff at village level is trained to treat common health problems, but not major one. Furthermore, at the district level is the district hospital that also supervises the health centers. Large cities have government hospitals, such as the one where Aman was taken, and also specialized government hospitals such as the ones in Hakim Sheikh's story. Do you know why health service is called public? Let me tell you. There are many reasons behind calling these services as public. Major among this is in order to fulfill its commitment of providing health care to all citizens. Also, the resources needed to run these services are obtained from the money that we as public pay to government as taxes. Recall the stories which we discussed earlier. We observed that the main differentiating factor between both types of services is money. Public healthcare services are either free or low at cost. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with participation of people. Okay students, let us talk about another category of healthcare services, which is Private health facilities. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In rural areas, one finds registered practitioners. Urban areas have many doctors, private hospitals, and nursing homes providing specialized services. Also, privately owned laboratories that do tests and offer special facilities like X-ray, ultrasounds, etc. Also, there are shops from where we can buy medicines. As the name suggests, private health facilities are not owned or controlled by the government. Also, these services are very expensive. So, this was the contrast between private and public facilities. In the next segment, we will study about some more features of healthcare facilities in India.